All right, good morning. Thank you so much for joining us on our WMAR-2 News Facebook page for this Facebook Live discussion. I am Megan Knight with Good Morning Maryland, and today we are talking about thyroid cancer, as September is Thyroid Cancer Awareness Month. So we always like to bring in the experts from Gbmc to help us break down these big topics and, more importantly, get your questions answered. So as you jump into the discussion and the conversation, please leave your questions in the comment section, and we will be sure to get to them as we go throughout this conversation. I am joined now by Dr. Farzad Masroor, who is with the Gbmc Head and Neck Center. He is a surgeon, a head and neck surgeon there. So, Dr. Masroor, thank you so much for joining us this morning and taking our questions.
Thank you for having me.
All right, so before we get into talking about thyroid cancer, the signs and symptoms, things like that, if you could please just kind of give us a little anatomy lesson and explain what exactly the thyroids are and how they help our bodies to function.
Sure. So the thyroid gland, it sits in the front of our windpipe. It's a butterfly-shaped organ, again, right in front of the windpipe. And its primary job is to make a hormone that we call thyroid hormone. And thyroid hormone really controls the metabolism in our body. So if you have, for example, a underactive thyroid gland, your thyroid gland is not producing enough thyroid hormone, and that in turn will cause your metabolism to slow down. And so then you can develop symptoms like weight gain, decreased energy, cold intolerance. And conversely, if you have too much thyroid hormone, then your metabolism is too high, and you can have, unintended weight loss, kind of tremors, and heat intolerance. So you feel too hot all the time. So that's kind of the main function of the thyroid gland. And just as a side note, but there are four smaller glands that sit on the thyroid gland. They're called the parathyroid glands. And their job is to produce a hormone called the parathyroid hormone, whose job it is to regulate calcium. So in that kind of space there, those are the main glands and the main anatomy.
Okay, thank you for explaining that to us. So when we're talking about then thyroid cancer, and you kind of gave some of the side effects there if your thyroids aren't working properly. But when we're talking about cancer, first of all, how common is this? I've heard of it before, but I have to say probably not as often as I hear about, say, some other types of cancers. So is it common to get? Does it affect certain age groups, men more versus women, or vice versa? Kind of talk us through that.
It is fairly common, and in the last 30 to 40 years, the incidence of thyroid cancer in the United States has increased greatly. So some studies have shown that from 1973 to 2013, around that time frame, the incidence of thyroid cancer in the United States has increased by about 200%. So 200%. It is probably the fifth most common cancer in women in the United States. And every year, probably a little more than 60,000 new cases are diagnosed. So fairly common, a little bit more common in women than in men. And its incidence is increasing over the last 30 to 40 years in the United States. Now, you may ask that, and then why that seems like an alarming thing, that the incidence has increased so greatly. But the caveat in that is that we do, the medical community and the thyroid community, we do believe that a lot of that rising incidence is due to the fact that we have better technology now, better imaging scans, and we're picking up cancers that are very small, that are probably clinically not going to ever do anything. And so we are basically picking up a lot of incidental disease that does not really make a difference much for the patient's symptoms, quality of life, or even affecting their how long they live.
Sure, but certainly just making them aware that it is there, and that you now have the technology to show that, and I suppose just to monitor it to make sure that it doesn't progress into something more serious.
Absolutely.
All right, so I guess good thing then to get into kind of signs and symptoms. Again, you kind of mentioned some of them earlier in the discussion, but if people are just joining us now, what are some of the things to be looking out for if something's not quite right with your thyroid?
Well, so I guess we have, for example, the metabolic disorders of the thyroid gland. We talked about that kind of briefly before, but If your thyroid gland is underactive, then you'll have a unintended weight gain. You may find that you're gaining weight even though you're not eating much. Your dietary habits haven't changed much. Your energy level may be much lower. You may be finding that you need to sleep a lot more. You may find that the cold is just that much more cold to you and you can't tolerate it. And all those signs can point to the fact that you have an imbalance in your thyroid gland. And that can be checked very easily by your primary care doctor by checking your blood work to see, what is the level of the thyroid hormone in your blood. But when it comes to thyroid cancer, oftentimes your body's ability to regulate your metabolism and make thyroid hormone has not changed appreciably. So those symptoms will not be reliable. Instead, if you have a thyroid cancer that is growing or is becoming bigger, then you will have symptoms typically based on what it is doing in the anatomy of this area. So if a patient has a large thyroid cancer or mass, then oftentimes it'll become visible because it's right over here over your windpipe area, and you may see a bump there. So in fact, I think that maybe 5 years ago there was a situation kind of similar to this. I mean, obviously not an interview with a head and neck surgeon, but it was on TV. And there was a news anchor talking, and someone in the audience found out. I was like, hey, there's a little bump on the news anchor's neck, and they were like, you should maybe get that checked out. And she was young, and she was in her 40s, and she had a thyroid cancer. So oftentimes it can be visible. The other things in that area we talked about before, being on your windpipe, if it gets fairly large, it can make it a little difficult to breathe. Behind the windpipe, you have your esophagus, and if a thyroid problem, a mass or a cancer or something is pushing on the esophagus, it can make it hard to swallow. There's also a nerve on either side of the windpipe that controls your vocal cords. It's called the recurrent laryngeal nerve, and that nerve is in a way it's sort of intimately associated with the thyroid gland. And if there's a problem with the thyroid and it's pushing on the nerve, it can make the nerve dysfunctional, which in turn can cause a person to have hoarseness or a change in their voice. So if you have a thyroid cancer that is large and it's growing and it's causing you issues, those are some of the symptoms that can happen. More commonly, actually, what we see a lot these days is that a thyroid cancer is picked up incidentally. So what I mean is that a patient has a CT scan for another reason or an MRI scan for another reason. Maybe they have some chronic neck pain and their doctor wants to evaluate their cervical spine. And in doing that scan, you just incidentally pick up a nodule in the thyroid gland. And then that leads the medical community down a pathway whereby we then biopsy that nodule and we find that there is some cancer there. And the nodule may be very, very, very small, maybe even under 1 centimeter in size. And if that's the case, then we're left with this situation where we're like, maybe this cancer was not really going to do anything. It was just picked up incidentally and may stay the same size for the rest of the patient's life. Oftentimes, though, the nodule may be a little bit bigger and it's picked up appropriately.
Okay. And how often does it turn out that the cancer or whatever you detect is incidental and doesn't need to be a big deal versus maybe this is something that we need to look into further?
Good question. Most thyroid nodules, the vast majority, so maybe some people estimate more than 90% of the nodules are clinically insignificant benign nodules. So having a thyroid nodule does not automatically mean you have a problem. In fact, thyroid nodules are very, very common. Some studies estimate that in our lifetime, amongst the entire United States population, during our lifetime, at some point, 60 to 70% of us will have a thyroid nodule. So it's very common. In some ways, it can even be thought of as the rule to the thyroid gland that at some point in your life you will develop a nodule.
Gotcha. So then would you recommend people doing neck checks, so to speak, on themselves, or is that something that they should leave to their primary care physician when they go in for their checkups?
Well, I mean, it's never a bad thing to be in tune with your body. It's never a bad thing to kind of know how your body is and know what your normal sort of neck feels like. And there are some lumps and bumps in our necks that we should be able to feel at all times. You should be able to feel your carotid artery here. You should be able to feel your salivary glands that sit below your jaw. And but having a bump or something that is new to you or is unusual, that is very helpful, because patients are their best advocates, and they should they should own their body and be in charge of it. So it's I never say it's a bad thing to check out your neck. Now, if you were to ask me the question, should we just do ultrasounds, on our neck just to see what our thyroid gland looks like, I would say no, don't do that, because it may be opening up a can of worms. And like Pandora's box. Yeah.
Sure. And just if you do feel something, just know that doesn't necessarily mean that you have thyroid cancer, but perhaps you want to go talk to your doctor and just, double check and make sure it's okay.
Exactly. Yeah.
All right. Well, for anyone just joining our Facebook Live discussion, thanks so much for joining the conversation. Just wanted to remind you, we are talking about thyroid cancer with Dr. Masroor from the Gbmc Head and Neck Center. So if you have any questions for Dr. Masroor, you can comment it on the in the comment section, ask it in the comment section, and we will be sure to ask him through this conversation. All right, so we kind of gone over signs and symptoms, what's exactly going on with our thyroids if cancer does impact it. So, of course, we want to talk about treatments. And what are some of the treatments that you offer at GBMC if you do have a patient who comes in and having some issues with their thyroids?
Well, it depends on what is causing the issue. So if you have a thyroid issue, say you have a goiter. A goiter is just a generic term for a very big thyroid. And it does not necessarily mean that there's a cancer issue. It does not necessarily mean there's a metabolic issue. The thyroid gland could just be filled with nodules and be very large and causing some symptoms, either pushing on the windpipe, pushing on the esophagus. It may just look unsightly. A person would be walking around with an obvious enlarged thyroid gland in their neck. But so surgery can fix that fairly easily. It can be done very safely, removing the thyroid gland. Now, if you have thyroid cancer, then we want to know what is the extent of the thyroid disease. Is it just in one thyroid lobe, and is it small? Is it in multiple spots in the thyroid gland, or is it very big? Has it gone beyond the thyroid gland into the neighboring structures? Has it gone into the windpipe or into the vocal cord nerve or into the esophagus? Has it spread to lymph nodes in either the central neck or the lateral neck? Has it gone to other parts in the body, lungs, bones, liver? That thyroid cancer can do that. So based on all those things, we can treat it. And so if the disease is localized and has not spread far and wide, then doing surgery can be curative, meaning that it can remove the disease entirely and do it safely and in a way whereby it should not come back. There are other things we do as well on top of surgery that can help eliminate the risk of it coming back, such as radioactive iodine, which is basically it uses the fact that most thyroid cancers, not all, but the most common type of thyroid cancer, it absorbs iodine, and iodine is important in thyroid hormone. It absorbs the iodine, and you can tag it with a radioactive chemical, which then selectively destroys thyroid cells. And lastly, even with patients who have disease that is, say, incurable in the sense that it's gone to other parts in the body, there are a lot of new drugs or medicines these days that are very targeted, and they can be used to target the most common sort of genetic abnormalities, molecular abnormalities in thyroid cells, and can keep the disease in check for many, many years with minimal side effects, and can prolong a person's quality of life considerably.
All right, very good. Looks like we have some people who are just joining our conversation, Dr. Masroor. So they would like you to repeat the symptoms or just what to look for if you have any concerns about your thyroids.
So I like to think of it in a couple of ways. So first, you can have a metabolic disorder, a thyroid metabolic disorder, which is probably very common. And that can be again, the thyroid gland, its responsibility is to make a hormone called thyroid hormone. And thyroid hormone is really the hormone that controls the metabolism in your body. So for example, if you have too much thyroid hormone, meaning you have hyperthyroidism, then your body is kind of like an overdrive all the time. You may find that you have difficulty sleeping. You may find that you have too much energy. You may find that your hands are shaking. You have a tremor in your hands are shaking very easily. And you may find that you're losing weight even though you don't want to lose weight. And that's not good for you to have too much thyroid hormone. Over time, those effects can add up and affect your heart. There is something that you can have basically a form of heart failure that happens because your heart is too overactive and is under too much stress. You can have poor, bone loss, and many kinds of things can happen. So hyperthyroidism is definitely something that needs to be treated. On the flip side, if you have too little thyroid hormone, then you will have hypothyroidism or underactive thyroid, and that'll cause you to have weight gain even though your diet has not changed much. It can make you feel very tired all the time. You may find that some people, their skin starts to change a little bit, they lose hair, and that is very common too. And obviously we need to know that as well, because if you have too little thyroid hormone, that's not a good thing either. Now, when it comes to thyroid cancer, which is a different ballgame, and thyroid cancer, the most common ways found these days is usually kind of in an incidental fashion, whereby we find a thyroid nodule by way of a test that was done for another reason. But if you have a thyroid cancer that is quite large or growing quickly, then the symptoms would typically be based on pushing on structures anatomically in that area. So either your windpipe, your esophagus, or the nerve that controls the vocal cord, or sometimes other symptoms too. But those symptoms, if it's pushing on your esophagus, you will have a hard time swallowing. If it's pushing on your windpipe, you can have a hard time breathing. If it's affecting your vocal cord nerve, you can have changes in your voice or hoarseness.
All right. Well, thank you for going over those symptoms again. And again, if you're just joining in and maybe you've missed some parts of our conversation with Dr. Masroor, we will post this on our Facebook page so you can watch the whole discussion in its entirety. We have someone here, Dr. Masroor, who just commented that they had thyroid cancer and actually got their thyroid taken out a month ago, which is something that you just touched on when you were talking about treatments as well. So when you have to get your thyroid taken out, I mean, talk about the recovery aspect of that. Is that something that could take weeks or months?
I would say, again, it depends on the extent of surgery, but the majority of cases, if it's just your thyroid that's removed and nothing else needs to be removed, it's a very safe surgery, and the recovery is very, very quick. It does not cause much pain. A lot of patients do just fine with Tylenol and ibuprofen after surgery. They don't need anything stronger. A lot of patients after thyroid surgery can go home the same day and start eating, liquids the first day and then go back to regular diet the day after. And so the recovery can be quite quick, and you can get back to normal activities quite quickly as well. So within a couple weeks, you can get back to some regular exercise. And a lot of my patients, they actually ask me, they're so surprised at how well they feel after a couple of days that they want to go back to work. And so the recovery can be quite good.
Oh, well, that's very good to hear. I mean, and it sounds like too, technology, like in all aspects of medicine, really has played a large part in, like you mentioned, detection and also treatment. And you were saying to me before the conversation too, that with thyroid disease and thyroid cancer, you have discovered, or doctors have discovered, that less is really more when it comes to treating this. Is that correct?
That's true. And in the beginning of our talk here, we did talk about the fact that a lot of thyroid cancers are being found incidentally, and there has been a big increase in thyroid cancer in the United States over the last 40 years or so. But some reports saying maybe 200%. And a lot of that it kind of points to the fact that I think we're finding thyroid cancers at a very early stage that would otherwise not go on to cause any issues in the patient's life if no one ever looked. And that the term we use for that sometimes is microcarcinomas, and they're just basically incidental findings. And a trend that is happening now in the United States, and this is kind of being patterned along studies that came out of Japan in the 1990s, was that for select patients with very small cancers, you can even actually just watch it with ultrasound and see if it grows or not. And a lot of these patients, even after 5 years, their cancers never grow. and they do just fine, even though they've had a diagnosis of thyroid cancer. They don't get any treatment for it. And then conversely, if there is some sort of growth on a regular checkup with an ultrasound, then you can intervene very quickly and take care of it without having lost any ground. So this is something which a lot of centers in the United States are now starting to think about. For example, in Memorial Sloan Kettering, they've done a lot of work on this as well, is this idea of active surveillance, meaning that you just do regular checkups with ultrasound, and you see if this is something that is going to become an issue or not. And so likewise, also, we do recognize that patients do very well with thyroid cancer, the typical kind of thyroid cancer. And maybe I'll just take a step back now and just kind of emphasize that there's very different types of thyroid cancers. The vast majority are something called differentiated thyroid cancers. But you also have other kinds of cancers like medullary thyroid carcinoma or anaplastic thyroid carcinoma, which are different entities altogether. Okay, and those tend to be more aggressive cancers. They are rarer than the differentiated thyroid cancers. They're not common at all. But if they do happen, they need to be treated very aggressively. But for the sort of the bread and butter thyroid cancer, differentiated thyroid cancers without any bad features on their biopsy, less tends to be more. And so, for example, if you have a small cancer in one of the thyroid lobes, just removing one half of the thyroid gland is sufficient. You don't have to remove the entire thyroid gland as they did maybe 20, 30 years ago. And so this is an area of active research, and we're learning more about it. But again, I think your way of putting it, less is more, is kind of apt.
Another question for you, Dr. Masroor, is there a test for thyroid cancer, and does it make your lymph nodes swell up?
Is there a test for thyroid cancer that would make your lymph nodes swell up? So the way we typically test for thyroid cancer is we typically will do a biopsy of something that looks suspicious. And again, this is for differentiated thyroid cancer. So if you have a nodule in your thyroid gland that was discovered, the way to diagnose it, of whether it's cancer or not, is something by doing a needle biopsy. The technical term that's often used is something called a fine needle aspiration, or FNA. And what that entails is that we put a small needle into the thyroid nodule, we suck up some cells into a syringe, and then that gets put onto a slide, and a pathologist looks at it to see if the cells are abnormal or not. And if there is thyroid cancer there, then you can have a fairly good idea with this test of whether there's thyroid cancer or not. Same reason, if you have a lymph node that looks abnormal, we tend to biopsy those the same way, with a needle into the lymph node. And I do think that sometimes with these needle biopsies, either in your thyroid gland or in the lymph node, it can make those structures swell up a little bit. That's not uncommon, but it should go down with time.
Okay, so pretty painless, I guess, to biopsy this and to just check and make sure what the situation is.
It's a very easy procedure and relatively painless.
Very good. And again, if you have any other questions, we're probably just about to wrap this up, but if you have any last minute questions for Dr. Masroor, please get them in. So I think you kind of touched on this just a little while ago, but talk about too the recurrence rate. If you are diagnosed with thyroid disease or thyroid cancer, is this something that once you have it, you kind of have to watch for it the rest of your life, or if once treated, then you don't have to worry about it?
The recurrence rate depends on a number of things. It depends on what stage your disease was. So if you had an early stage disease that did not have any adverse or bad features on the biopsy, meaning that the thyroid cancer is confined to the thyroid gland, it did not go beyond the thyroid gland, it has not invaded many blood vessels in the thyroid gland, the type of cancer cells when they look at it with a microscope, look like the classic form and don't look like some of the bad actors, which we can sometimes see rarely, then your chance of it recurring is fairly low. But some studies do say somewhere between 7 to 10% of cancers recur. And if they do recur, it can be treated again, usually pretty successfully. And most recurrences, when they do happen within about 77% of them will happen within the first 5 years. So if you can make it beyond 5 years without any recurrence, you can feel pretty comfortable that it will not come back.
All right. Another question for you is, how do you find a good endocrinologist to manage your thyroid issues?
That's a good question. And
or is it something that you should do if you do have thyroid issues? Say you were diagnosed with disease or cancer, maybe you're in the clear now, but just kind of like what you were touching on, something that maybe you need to keep an eye on. Is it worth having an endocrinologist as part of your team to make sure that you are doing the right checkups at the right times?
Yeah, I think that if you, a lot of primary care doctors can do a fairly good job with thyroid issues, but if it gets a little complicated, then an endocrinologist is a good place to go. And over here at Gbmc, one thing, myself, for example, being kind of new to this system and just establishing my practice, one thing I find kind of helpful sometimes is to go on. You can go to gbmc.org/find a doc, and that will kind of give you the sort of our sort of offerings we have in the Gbmc system about which doctors, you can see our endocrinologists and such. But otherwise, I think, finding a good endocrinologist, that's a kind of a subjective thing, it depends on your comfort level with your doctor and what kind of rapport you have with them. And I don't have any sort of hard and fast rule about how to find that doctor.
All right. And actually, we just posted a link to Gbmc's Find a Doc page. So if you are looking for an endocrinologist or any sort of doctor, specialty doctor, we got the link up there for you right now so that you can go and find that. All right, another question here is, and again, something we've touched on earlier, but what causes thyroid cancer? This person says they were a smoker, had neck and spine surgery 4 years ago, had stents placed in their neck. They're noticing their throat is sore more often and making it hard to swallow. So she wants to know if she should get her thyroid checked.
I think getting your thyroid checked is a very easy thing to do. You can have your blood. You have a blood test to see if your thyroid gland is underactive or overactive. Very easy to do. Very common test to be done. And a thyroid ultrasound, if you're concerned about thyroid nodules or thyroid cancer, a thyroid ultrasound can pick up abnormalities. Now, some of the symptoms that last participant were asking can be due to a lot of things, though. I would not automatically jump to it being thyroid related. And so for that reason, this is a good conversation to have with your doctor, and together you guys can come together with a plan.
Good. And speaking of causes, is smoking a factor? Is this more like a family history type disease, cancer, or are there more outside factors that can play a role in causing these issues?
Smoking does increase your risk for all cancers, and thyroid cancer is no different. And also smoking does increase your risk of forming thyroid nodules. So of course, smoking can be an issue. Family history can be an issue for certain types, especially for certain types of thyroid cancers, like medullary thyroid cancer, which is really known to have a genetic basis for certain types of genetic mutations, and it can even be part of genetic syndromes that we sometimes see. Other risk factors can be, and this is probably some older patients will see this, but if you've ever had a history of radiation to your neck area for other reasons, for example, for lymphoma, and even some older patients back in the day, we would give radiation to the head and neck area more liberally for other reasons, but that can increase your risk for thyroid cancer too.
All right, good to know. I think we have another question here. It says, why do most doctors not do the full thyroid panel, just assume TSH is sufficient to determine when many have normal TSH but abnormal T4 or T3?
Mm-hmm.
It sounds like a lot of medical jargon here, Dr. Masroor. So
yeah, that's a very sophisticated question, and maybe better answered by an endocrinologist. But I will say I don't feel like it's out of my ballpark necessarily to give some input on. I would say that the reason why a TSH is often checked is that it is the most sensitive indicator of thyroid function. Thyroid function in the body works with a feedback loop. So the TSH is released from a gland in your brain to tell the thyroid gland to make more thyroid hormone. And when the thyroid hormone when the thyroid gland, for example, makes too little thyroid hormone, then the TSH level will increase. And if it makes too much hormone, then the TSH level will go down. And it's a very sensitive, tightly tuned feedback mechanism. And this is the reason why we typically check TSH. Now, the question, the participant is right that sometimes you can have, not commonly, but you can have a normal TSH, but abnormal actual thyroid hormone levels. And so for that reason, I myself typically check the whole panel, but it's not, I would say most doctors would agree that if there is concern, then you can check the whole panel, and that's not too much of an issue.
All right, very good. All right, well, as we start to wrap up here, I don't see any more questions. Dr. Masroor, is there anything you would like to add that we didn't touch on here? And we're going on 30 minutes. I think we've covered quite a bit, but is there anything else that you think is important for people to know about their thyroids and taking care of them and thyroid disease or cancer?
I think we covered a lot of ground, and I hope that we weren't too technical, and I hope I wasn't too chatty.
No, that's the whole point of this. We want you to be chatty. You gave us a lot of good information.
Okay, good. But if there's any issues, we are at GBMC. We want to help you. We want to be available to you. Reach out to us, and we are happy to answer your questions. And even if it's something that, for example, if a patient were to reach out to me and say, I have a question about my thyroid gland, but it's something that is probably a little bit outside of my expertise, I'm happy to point the patient in the right direction. And over here, we really want to make sure we get you to the care you need.
Absolutely. And a lot of fantastic doctors over there at GBMC. And you can always visit gbmc.org for more information if you are looking for a specialty doctor, if you just have any generic questions. Always a good place to start there. So Dr. Masroor, thank you so much for joining us this morning on our Facebook Live discussion. Lots of great information. And again, we are going to post this on our Facebook page. So if you missed any portion of it or you want to go back and rewatch something, we're going to have it posted for you there. And you can go back and watch it as many times as you would like. So, Doctor, thank you so much for joining us.
Thank you. All right. Bye-bye.
Bye-bye.